Good morning, or good afternoon, everyone. It's not morning anymore. Good afternoon, everyone. Thank you so much for joining us. My name is Daryan Jones. I'm the Caregiver Education and Digital Specialist at Care Partners. We are so excited to have you guys here today. We're covering a topic that I think is just really important, and it's something that everyone can use and be mindful of. Today, we'll be talking about fall prevention and fall prevention tips, and just kind of how to be safe at the home. So home care assistants, we have several people joining us from home care assistants today. Angela, Chandeep, and Anne. So we're gonna bring them up in just a second, and how do we get everyone? There we go. Welcome, guys. Thank you so much for joining us. Real quick, we'll just go around and have you guys introduce yourselves. Anne, do you want to start?
Sure. Hello, I'm Anne. I am a client care manager here with Home Care Assistants. And thank you so much for having us.
Hi, my name is Chandeep Sharma, and I am also a client care manager with Home Care Assistants, and glad to be here. Thank you.
And hi, my name is Angela Davis. I'm a client care manager as well with Home Care Assistants, and I'm happy to be here. Thank you.
Thank you guys so much. So we can just go ahead and get started, I guess, if you guys want to take it away, and we'll get into fall prevention tips today.
Sounds good. Thank you.
Thank you, Darren. So I will start by talking about fall prevention. So as we know that falls by aging adults are serious events. Many falls are life-changing that can dramatically affect the quality of life. So I will start with the statistics. Each year, millions of older people fall. In fact, more than 1 out of 4 older people fall each other, but less than half of them tell their doctor. So here are some statistics. Elderly people that are admitted to the hospitals due to a fall tend to have twice as longer stay at the hospital than those of elderly patients that go to the hospital for any other treatment. 1 out of 5 falls causes a serious injury such as broken bones or head injury. Each year, 3 million people are treated in emergency departments for fall injuries. Women have greater risk of falling than men, and it increases with age. Women more often have osteoporosis, a disease that weakens bones and makes them more likely to break. Annually, 1 out of 1/3 of reported falls in elderly, 2/3 of those who fall will have likely chances of another fall within the 6-month period, which means falling once doubles your chances of falling again. The leading cause of death from an injury among people 65 and older is related to falls. More than half of all fatal falls involve people 75 or over. Among seniors 65 to 70, 1 out of every 200 falls result in a hip fracture, and that number increases with age. Each year, at least 300 older people are hospitalized for hip fractures. Falling sideways, causes more than 95% of hip fractures. Women experience 3/4 of all hip fractures. 1/4 of seniors who fracture a hip from a fall will die within 6 months of injury. Falls are the most common cause of traumatic brain injuries. The most intense effect of falling is loss of functioning associated to independent living. And all this data was collected from the CDC website. And if you can tell, I mean, some of this data is very intense. We do not take falls as seriously. I mean, we do not understand the intensity of a fall, but they can be life-threatening. And I'm going to pass it over to to Anne to talk more about it. She's going to talk and take over.
Thank you, Chandeep. So I wanted to talk a little bit about kind of what causes a fall and some of their impacts. There's some emotional impacts of a fall, And I'm trying to get fully in the screen there. For some reason, I feel like hold on. Excuse me, ladies. There we go. There's some physical impacts of a fall, and I know some emotional impacts as well. So we just wanted to talk a little bit about that and then kind of move into some of our fall prevention tips. But these are some of what's causing a fall and then some of their impacts as well. So when we talk about falls, some of those physical and environmental factors could be some of actual balance disorders. Things like could be Parkinson's related disorders or other medical conditions, also vision problems. And I know Angela will kind of go into that and why it's important to, visit your doctor, things like that regularly. And other physical weaknesses that you may be experiencing. Sometimes when we have a slower gait as we age, those may also be some physical factors that can go into relating to a fall. Also your home hazards. So poor lighting or lack of stair railing. I know Angela's going to kind of go into some of the home, how we can prevent those falls in the home, but lack of stair railing or a high amount of clutter in your home, those can be adding to your risk of a fall. Wearing floppy shoes, those can be adding to your risk of a fall, or even loose clothing. If you've lost, maybe your pants are starting to drag, things like that. Those, it's all in the, so that type of clothing that is dragging on the floor, that can also, increase your risk of a fall. Unsafe use of your equipment that you've been given by a doctor over time, such as your walker or a cane. If you're not using those items properly, those could actually increase your risk of falling and not help you with falls. So it's important to be using those items properly. And then we also understand that there's, of course, physical injuries that come with falls. And we discussed that a little bit earlier with whether you might be a broken bone or a hip, a pelvis break or head injury, but there is an emotional factor to those falls as well. And part of that is once you've fallen, it's that fear of falling again. And we don't want you to get stuck in that cycle of, now that I've fallen, I'm afraid to go out and enjoy my life anymore, or now I'm not going to get up as often. And so once you kind of get stuck in that cycle of, well, I'm not going to get out of my chair as often. So once you're sitting too much, you experience muscle weakness, which can actually increase your risk of falling more. So it's that cycle of that fear or anxiety. Once you've fallen, you don't want to fall again. So that's actually an emotional impact of your fall. And we'll kind of talk about kind of how we want you to move past that emotional impact of your fall. So thinking about that isolated feel after a fall, we want you to reach out to your family, talk about that, loved ones, whether that's in your community with a pastor or your medical professional. You really want to kind of talk through your fall and move past that emotional impact so that you are feeling stronger and still able to live your life and get back to the things that you enjoy, both physically and emotionally. So we don't want you to move into bad habits once you've fallen, such as always looking down. Once you've had a fall, you might be fearing the fall. So now you're looking down, but that's not very helpful because that could then lead to another fall. So we kind of get into these bad habits once we've fallen, not realizing that they could lead to another fall. So seniors experiencing falls, we notice that they've delayed some of their routine activities, such as going to the bathroom, and then going to the bathroom or getting up to get a drink of water, which then leads to dehydration. Dehydration leads to dizziness. Dizziness leads to falls. So again, all these impacts that have happened from a previous fall, it's that cycle. So breaking that cycle of the emotional impact of previous fall is very important. But I do want to kind of enough of the bad news of your fall, but I want to have Angela talk about really how to prevent your fall. And then I know we're going to open it up if there's any questions as well. Angela, let's talk about how to prevent the fall.
Thank you very much, Chandeep and great information. Now we're to the point, preventing falls. That's what we want to do. Research, it demonstrates that seniors who definitely avoid they avoid falls by decreasing risk. And the following tips that I talk about definitely are some ways that we can do this. Simply by, if you have difficulty maybe walking, or your balance is off, or you maybe fallen in the past year, you might want to talk to your healthcare provider about having a special falls risk or some type of assessment. If you know that things are unusual, your balance is off when you get up, and we know that a lot of things can contribute to that. So call your healthcare provider and let them know that, hey, I'm not feeling well, something's off, so that you won't prevent a fall, so that you can prevent a fall. Also, ask your provider if you would maybe benefit from some type of exercise program to prevent the falls. That's very important. Sometimes we don't move enough. Maybe we need to do some things differently. Maybe having a physical therapist or occupational therapist come in, if you qualify for that, to come in and to assist you with some exercises. And then, also talk to your doctor about, just doing some simple home exercises that can, for strengthening or to help with balance and things like that. And then, of course, he could talk to you definitely more about if you need to seek further assistance with those type of things. So think about, if you've fallen before, you might want to even look at buying some type of special alarm, so that when you do fall and you live alone, then you're not left there for hours and hours. When both Chandeep talked about in the statistics that when someone has a fall, it really does impact you. Sometimes those things could lead to broken hips. They could, you're there, someone finds you, you're there for a long time, and you just didn't have that intervention where you could get someone to you quicker. And it makes a whole lot of difference. So you might want to look into exploring the various alarm systems, alert systems that can assist you with the fall prevention. Then, if you also don't rush, a lot of times now we're just rushing all the time to get here and there. It's very important that you just be strategic and deliberate just about what you do. Just be very careful about rushing. Sometimes there might be a phone call that you have to get to, but majority, or your phone might be across the room. Don't rush to get that phone, because it could lead to definitely you tripping on something or falling. Please, check in your home for trip hazards. Could be throw rugs, those things, the beautiful rugs that we love, and, those things that could really trip you, or even your pet. Be very careful about that. I've had many clients before who have fallen, who tripped over their pets. Those things, you could have someone to come in and provide an evaluation of your home to find out what's safe and what's not safe. When walking on smooth floors, it's very important to wear non-slip footwear, non-skid socks, slippers that have grips, uh, bottoms that are flat, thin-soled shoes, those things that can help you. We love to have our shoes on that are a little thicker sometime, or slippers that are very pretty, but we want to remember that those things sometimes can be a hazard, and we want to make sure that we have the right type of footwear on. If you have a cane or a walker, just remember to use it at all times. And then also during the evaluation that I talked about before, when you talk to your doctor, and if he does want you to have some type of physical therapy, occupational therapy, they can surely help you assess what's needed in the home. Make sure that all of your hallways, stairs, paths, that they are all well lit, clear. Sometimes it only takes that one time to move in a dark area that you think that you're familiar with and you've had a fall. So you want to be careful to make sure that your pathways are lit. Many times I find even in my own space that I felt sure about that I can make this to one point or another, and found myself having a trip or a fall because I could have just simply turned on the light so that my pathway was lit. And it could have really led to a fall that could have caused the injury. So make sure that we do those things. Make sure that, once again, your pets and all of that are out of the way. Use rails and banisters when going up and down your stairs. Never place scatter rugs at the bottom or at the top of the stairs, because they could really you could really have a horrible fall that way. And then they have ways that you can tape your rugs down on the floor so that they don't move as you walk on them. So these lifestyle changes are just very important. Start or increase physical activity once again, improve your muscle strength, balance as well. And then also incorporate the various flexibility activities and then strengthen your endurance. You find that inactive adults, they should start slow. If you haven't been doing this, walking around, gardening, and also swimming are some popular activities that some can do. As well as maybe yoga is great for you, and to build balance that can help and prevent falls. But please, once again, as I've said in the beginning, check with your doctor. Start there if you find that you have changes in your balance or if you're having issues with falls. So it's those simple tips that they're not all the tips, but these are some simple tips that can assist you with this.
Uh, there were a couple of things I was going to add to that. I was just going to say that besides that, there are a few more things that you can do. For example, medication. Sleeping medication can compromise balance, so you can be mindful of that. And then also re-accessorizing. Sometimes people who wear bifocal lenses, when you're walking outside, you're stepping down the curb. Yeah, you might not have a right perception of the depth.
Right.
So it's always recommended that you do not wear your bifocals.
Right.
And then the last one is using the restroom frequently. We all drink water, and it's recommended that drinking water is good because it helps us with the dizziness. But at the same time, if you're waiting too long to use the restroom, you might be rushing yourself to the restroom, and that can also lead to a fall.
And just remember also, and thank you, Chandeep, for those reminders. One other is now during COVID, we're wearing our mask, and some of us who are wearing eyeglasses, we know that sometimes our eyeglasses fog up. You can't see as well. It does interfere with the perception that we might have. So just be careful with that as well. When you have your mask on, when you're out walking, make sure that you make those adjustments so that you'll be able to see clearly and that it will be safe for you.
Thank you guys so much. That was some really important and helpful things to think about, the just not rushing and making sure the floor is clear and just all those things that you guys talked about. I had a question. So what if someone does fall, or do you guys have any tips for that? So let's say you're alone and you fall, and then we'll go to another situation.
Well, Who would like to take that? Chandeep?
Yeah.
I'm sorry. So sorry, repeat the question, please.
If you're alone and you fall, do you guys have any advice for that?
Sure. I mean, definitely. I mean, if a person falls and they're alone, uh, there are a few things you can do. I mean, first of all, it depends upon the fall, what type of fall it is. I mean, how intense the fall it is. If they are able to, reach the phone, I mean, we always with we recommend that if you are able to get up, I mean, you can get up. But I mean, if you're able to reach the phone, you should call 911 or call the paramedics to see that if they can come out and check on you to see if you have fractured any bones. I mean, that's number one thing, because even with our caregivers in the house, we do not recommend for them to pick up a client from the floor on their own if there was a fall, because there are big chances that a client may have broken their bone, and we do not make it worse by trying to pick them up. So, definitely it is imperative that you get that checked out. So that's the advice, that you get, some assistance right away.
And then you kind of touched on it a little bit, but my next question was going to be, so let's say you're a caregiver and your loved one has fallen. What would be your advice for them if maybe they can't lift them?
Yes, absolutely. So if they cannot lift them, I mean, as I said, that they need to have some professional help. It is never recommended that, because when you try to pick someone up from the floor on your own, you may make their situation worse. If they have a broken bone, it will get worse.
Or you could have two injured people on the floor.
And exactly. So I think reaching out to professionals is always the best go-to when you don't really know the answer. And do you guys have any items or accessories or things that can actually help with fall prevention or lifting or things like that? Like straps. I've heard of some like straps you can use or things like that.
Well, as client care managers, when we're going in and we're assessing the environment, we can discuss with them, just we're not therapists, however, making, recommendations to, seek, an evaluation and things like that. If they're discharging from rehab, we might ask the question around gait belts and things like that for when the caregiver is assisting them. And then also, just to look at various equipment they have in the home that can assist them. We'll ask about rolling walkers and things like that. Definitely, that's something that we partner with folks to ensure that that's appropriate for them. But we might ask during our assessment if that's something that they have to aid in their, functional ability.
I was going to say that's something that when we're working with a family, that we're going in during an assessment or during a home safety assessment and really looking at is someone at risk for falls? Are they a fall risk? What does that look like? And right, are we using a gait belt? Is our client are they at home alone? Do they have someone living with them? Are they utilizing walkers, wheelchairs? I'm working with a gentleman right now. We're coming in, and I mean, even little things like using bright neon duct tape and putting it on some of the steps, just because it's easier for him to see. He has, some vision issues, but that makes it just on the 2-step landing, it makes it slightly easier just for him to identify where those steps are. And I think it's sometimes, right, those small details, it does make it a little bit easier, to identify where some of those fall risks might be, but utilizing some of the tools like a gait belt to help, like Angela said, transfer for somebody, or a sit to stand device to help folks who are having maybe an issue just in standing up, or that's where they find that they're at most risk to fall. But seeking the advice of someone who that is, whether that's their medical professional, their physician, if they're seeing a physical therapist right now, they're able to utilize those devices and get just good recommendations for what they're going through right now, with the understanding that as time goes on, their needs may change. And what they used 2 years ago very well may not be what they need today. They may need something different.
Absolutely.
And it is very important for, people, who are not stable on their feet. And if they have an equipment, for example, if they have a walker, they need to make sure that they're using that equipment. They are, religiously using the walker or the cane, the assistive devices that they have, so that the falls could be prevented.
Yes, very, very good advice. One other thing I wanted to touch on was the use of handrails or things like that in the home to also kind of help, depending on the situation, of course, and you'd obviously want to consult a professional to help with that. But is that something you guys might recommend depending on the situation?
Oh, most definitely. When we're going in, it's always important for us to, especially if someone needs assistance with showers and bathing, and we're looking at those items and looking at the toilet to ensure that it's high enough for them, if they have bars up and things like that. Our families are definitely, you're partnering with them because, they have these thoughts and they just need, that the recommendations, and just to know that it's okay and that they can do this. So yes, we do take a look at all of those things. And even to your previous question, you talked about what do we have that we have non-skid socks so that we, for safety as well, that they can utilize. But yes, your question to items to be installed, yes, we definitely do go around and provide an assessment of what's in the home and to ensure that, they're safe. So.
Awesome. And if you guys at home who are watching have any questions or want to reach any of our speakers today, their contact information is up on the screen. So you can visit their website, homecareassistance.com, or you can call the number on the screen. Thank you guys so much for being here today and sharing all of your wisdom. We hope you guys at home got some of your questions answered or enjoyed what we covered today. If you guys want some other topics covered, be sure to let us know in the comments. And other than that, I think we're going to wrap it up for today. But thank you guys so much for joining us.
Thanks, Daryan,
for having us. Bye-bye.
Thank you guys. And thank you guys